Occupational exposure to silica dust, a simulated case study. In this simulated case study, we will explore the occupational exposure to silica dust and its associated health effects. We'll follow the story of John, a 45-year-old construction worker who has been exposed to silica dust over the course of his career. During the medical examination, John describes his symptoms to the doctor. The doctor performs a physical examination and orders several tests, including pulmonary function tests and chest X-rays. John has worked in the construction industry for 20 years, primarily as a mason. Throughout his career, he has been involved in tasks such as cutting, grinding, and drilling materials containing silica, such as concrete and stone. Despite using personal protective equipment, PPE, sporadically, he has been exposed to silica dust on a regular basis. One day, John begins experiencing shortness of breath and a persistent cough. He also notices chest pain and fatigue, which have been worsening over the past few months. Concerned about his health, he decides to visit his doctor for a checkup. After reviewing the test results, the doctor diagnoses John with silicosis, a lung disease caused by inhaling silica dust. The chest X-ray reveals characteristic findings of silicosis, including small nodules in the lungs and signs of fibrosis. The pulmonary function tests indicate reduced lung function, further confirming the diagnosis. The doctor explains to John that there is no cure for silicosis, but treatment focuses on managing symptoms and preventing further progression of the disease. John is prescribed medications to alleviate his symptoms, such as bronchodilators to improve breathing and cough suppressants. The doctor also advises John to avoid further exposure to silica dust and recommends regular monitoring of his lung function. The diagnosis of silicosis has a profound impact on John's life. He realizes that his years of occupational exposure to silica dust have led to a serious and potentially life-threatening condition. John must now cope with the physical limitations imposed by his illness, as well as the emotional toll of facing a chronic lung disease. Reflecting on his experience, John emphasizes the importance of preventive measures to protect workers from silica dust exposure in the construction industry. He advocates for stricter enforcement of safety regulations, including the use of engineering controls, such as wet methods and local exhaust ventilation, to minimize dust generation. John also emphasizes the importance of proper training and education for workers on the hazards of silica dust and the use of appropriate PPE. John's case highlights the significant health risks associated with occupational exposure to silica dust. Silicosis is a preventable disease, and efforts must be made to reduce silica dust exposure in the workplace through effective control measures and worker education. By implementing comprehensive safety measures, employers can protect the health and well-being of workers like John and prevent the occurrence of silicosis and other silica-related diseases.